Madam President, I rise today in honor of a birthday. 49 years ago today, Medicare was signed into law. Every year, the trustees perform a report about the fiscal health of Medicare and Social Security, and that report was issued earlier this week. So on this birthday, 49th birthday of Medicare, I want to come and talk about Medicare's health because there's some good news. The 2014 Trustees report released earlier this week looks at the trust fund financing for Medicare hospital coverage and indicates that that trust fund, under current projections, will remain solvent until 2030. Last year, the 2013 report indicated that that solvency period would go to 2026. So in 1 year, the fiscal projection for the health of Medicare is improved by 4 years, solvency until 2030. In addition, the projected Part B premiums, the Part B portion of Medicare, which is prescription drug premium program for seniors, for the second year in a row, the premiums will not increase 1 penny, second year in a row. Mr. President, this improved health of Medicare is significant. What explains the improving solvency of the Medicare Trust Fund? Why would it have changed so dramatically from the 2009 to the 2014 projection and added 13 years of solvency to the trust fund? Well, the Congressional Budget Office and others have indicated that it was not the 2009 recession that was the primary driver for Medicare spending reduction. Instead, the CBO and others are indicating that a large part of the improved solvency of Medicare is because of the reforms that were included by Congress when Congress passed the Affordable Care Act in 2010. Mr. President, when it comes to reducing costs, bending the cost curve, the Affordable Care Act is working. That's not the only reason that Congress passed the Affordable Care Act. Coverage is expanding. Certain health care indicators are improving. More people have access because they're not denied insurance because of pre-existing conditions. Kids can stay on family policies. Businesses can get tax credits if they're small. But one of the areas, and that was why the first day in ACA was affordable, was to try to do things that would control health care costs. And this Medicare Trustees report on Medicare's 49th birthday shows on cost reforms the ACA is working. The innovative systems of changing the payment model from pay for procedure to pay for quality, for paying for value over volume, for reducing costs and improving healthcare delivery systems are extending the solvency of Medicare. Now, not only is this cost containment good for the federal government, for the federal treasury, it's also good for Medicare recipients. 8.2 million Medicare recipients saved more than $11.5 billion on prescription drugs thanks to closing the Medicare Part D donut hole. And in Virginia, people with Medicare saved $254.4 million on prescription drugs because the Medicare Part D donut hole was closed just since the ACA was enacted, $254 million since the 2010 enactment. In 2013 alone, 37.2 million Medicare recipients received free preventive benefits, including more than 900,000 in Virginia because of the Affordable Care Act. And so, Mr. President, I conclude and just say it's good for Congress to act. You know, we can filibuster, we can debate, we can, consider nominations. We can do a bill in one house and send it over and wait, like immigration reform, for a year plus for the other house to do something about it. None of that's action. None of that will fix any of the challenges that face us. But when we do act and we're willing to tackle tough problems like Medicare cost growth, and we do it in both houses and we take a risk, we will find that we'll be better off than if we don't act. Social Security needs to have the same kind of focused and careful attention to it, especially the disability insurance program, as we paid to Medicare in 2010. Medicare is one of the best programs that this nation has ever embraced. I want to wish it happy 49th birthday today and congratulate those who were here in the Senate in 2010 for being willing to risk action and thereby finding a way to save costs and make Medicare work better. Thank you, Mr. President, and I yield the floor.